What a wonderful morning to be celebrating you today. My name is Dr. Peggy Murphy. I'm the Director for Student Affairs, and we'd like to start this morning by first having a processional of those who will be on stage this morning. Okay, Dr. Warner, Dr. Chandler, Dean Lewis, Chancellor Golly, our guest speaker, Dr. Barton, Provost, Dr. Alan Kay, and Dr. James Morris. Y'all can be seated, thank you. And Dr. Beal. It is my privilege to welcome you to our annual White Coat Ceremony. To the class of 2023, it is a day to celebrate hard work and you becoming a physician in 2 years. The white coat is a visible symbol which testifies to the hard work required to become a physician and the heart for altruism and service. This ceremony marks the moment when students are moving from the laboratory and the classroom to the clinic and the hospital. From today forward, the person wearing the white coat promotes an outward symbol proclaiming he or she is committed to healing, compassion, problem solving, and integrity, striving to do what is best for his or her patients. You are not only healers, but scientists, physicians. Your patients will be relying on you for the truth in order to make the best informed decisions which are expressed through your doctor-patient communication skills. We take pleasure in knowing that LSU Health Shreveport School of Medicine has done everything we can to provide you with the skills to become great physicians. I know that each of the family and friends that are here today with us and those watching from home are just as proud of these medical students as we are. I remember the amount of pride I felt sitting in your shoes just a couple of years ago when my son was a participant in his class in the White Coat Ceremony. Each of you has had an influence on making these students who they are today. And in a very real sense, their success is your success as well. Class of 2023, we are proud of you and will depend on you in our communities and teaching hospitals. With that being said, I would like to introduce the physicians seated on the stage behind me. Chancellor Golly. He is also chairman of Oral and Maxillofacial Surgery. Dean David Lewis, Dean of the School of Medicine and chairman of Obstetrics and Gynecology. Dr. Alan Kay, Provost and Vice Chancellor of Academic Affairs. Dr. Shane Barton, Chairman of Orthopedic Surgery and Thomas Norris, MD, Endowed Professor. Dr. Debbie Chandler, Associate Dean for Student and Diversity Affairs and Associate Professor of Clinical Anesthesiology. Dr. Jennifer Warner, Associate Dean of Academic Affairs and Director of Cleft and Craniofacial Surgery Fellowship. Dr. James Morris, Associate Professor of Gastroenterology, and Dr. Lauren Beal, Professor of Clinical Internal Medicine and Pediatrics. Dean Lewis, would you please come forward and say a few words?
Morning, what a beautiful day. I wish I was out playing golf. No, I'd rather be here with you guys. That's later, right? It is so great to get back together, isn't it? I mean, you know, I feel like I've been in a cage for a year. I don't know about you guys. And it's been particularly hard on our students. You know, some of them opt to learn from home or learn from other areas and not come to class, but many of them actually would be in class and now are being allowed to come back to a large degree. I know I'm giving two lectures next week, and I'm expecting at least a couple of y'all to show up. But I'd also like to welcome our visitors today that are both watching online and those that are here. This is a big day. You know, these students have gone through undergraduate, and made the grades and ultimately got into medical school. And now then, they've gone through 2 years of book training, and it's time to get real with this whole thing. And that's what this is really all about. It's really about you guys. You know, you will never leave the classroom behind. You will always be a learner in medicine until the day that you die. But we're going to get you to where you really learn. And where you really learn is over in the hospital and in the clinics. That's ultimately what will make you a great physician. And so I'd like to welcome everybody. Thanks for being here, and I look forward to this great day.
Thank you, Dr. Lewis. At this time, I would like to introduce you to Dr. Golly.
Good morning, everyone. I'm really happy that we're here today, particularly for the families, grandparents, parents, spouses. I wish we were able to accommodate more people, but because of some of the social distancing and things like that. But as Dr. Murphy and Dr. Warner and Dr. Chandler and everyone else will tell you, I was pretty adamant that we were going to have this ceremony in person this year. Last year, it was tragic that we weren't able to do it in person. We had it virtual, and I made a commitment that we would have the match day, which we did yesterday, in person, and that we would have this white coat ceremony in person, and that we're going to have graduation this year in person as well. And I think that that's important, and it's important for the families. Virtual is okay, but it ain't the best, right? So I really want to welcome all the families here today of the 146 second-year medical students. I know some of you very, very well. Some of you I don't know so well. I hope to get to know over the next couple of years. This is a beautiful day today here in North Louisiana, and it's a great milestone for all of the students that are here today, as well as their families and friends, whose support has been so vital in developing their careers. And I want to thank all of you for being here. Dr. Murphy just talked about the history and tradition briefly of the physician's white coat. And I was debating this morning, do I wear my suit coat? Do I wear my white coat? I ran into Dr. K over at the school today, and I decided I'd put my white coat on today. I've done this before, and I've had the other coat, which is important because I can guarantee you, out of this class of 146 students, there's going to be a few of you that, for some reason, have a brain infarct like I did and decide you want to help in some administrative way. You know, hypoxia works in amazing ways, doesn't it? But let me just tell you this. Regardless of what position you go into in your careers, never give up the practice of medicine. Never give up the practice of surgery. Never give up the practice of whatever you go into, because that's going to be what keeps you connected to the students, connected to the residents and faculty and the nurses and the people that are but most importantly, it's going to keep you connected to your patients. And that is the reason that God put you in the position that you're in right now. And don't ever forget that. Well, parents, we could just hand them a white coat and just send them along their merry way to their clinical rotations. But I think it's important that we make a ceremony of this because it celebrates their accomplishments to date. And more importantly, it formalizes the great responsibilities that lie ahead in their interactions with patients and families. Guys, and when I say guys, it's not generically based. It applies to everybody. There are going to be things that people tell you that you will have to take to the grave. The patient-doctor confidentiality is very, very important. As a physician, I'm proud to wear the white coat as it symbolizes the science, humanity, and integrity of our honorable profession. For those of us who wear it, and for all who are receiving it today, it symbolizes our commitment to maintain our humanism despite any potential distractions that may occur, and believe me, there will be some, in order to provide the best possible care to our patients. Over the next 2 years of medical school, these students will have much to learn about patient care. Fortunately for them, there will be many, many fine teachers and mentors, just like we have up here on stage and that are standing around, and particularly someone like Dr. Shane Barton. Shane is kind of what I would consider a doctor's doctor, right? Anytime you get, there's always a doctor's doctor somewhere, where you take care, when doctor get hurt or something, you take care of them. So Shane is really one of those guys. I mean, I don't know, when was the last time you took care of one of my family members? Oh, yesterday, if I'm not mistaken. Dr. Barton has lived and practiced in Shreveport for the past 15 years. He's married to Tammy, who's right up here. I told Shane, I said, I can't get my wife to come to anything I'm doing, and I know he's proud, and we're proud to have you here, Tammy, and the support that you provide. Wonderful, Dr. Barton. They have 2 children, Ethan and Ella Grace. Dr. Barton's practice spans from non-operative sports medicine to complex operative reconstruction of the shoulder, elbow, and knee. His professional interest lies in the management of conditions involving revision and extensive bone loss procedures in the shoulder and elbow, as well as multi-ligamentous knee injuries. However, his professional and teaching interests also include medical issues facing athletes, medical education, and healthcare delivery to varied populations. Does work with, Special Olympics and just all sorts of groups. Dr. Barton, as was mentioned earlier by Dr. Murphy, is the Thomas Norris, MD, endowed professor and chair at our university, and is very active in resident, fellow, and student education. He now serves as Chief of Orthopedic Surgery and Sports Medicine for the Ochsner LSU Health System of North Louisiana. He serves as chair of the admissions committee here for our LSU Health Sciences School of Medicine. He has numerous hospital appointments. He has numerous appointments on national and international organizations. I'm not going to list them all. He serves as both a written examiner, a written question submitter, and an oral examiner for the American Board of Orthopedic Surgery. Dr. Barton has had numerous research interests, including clinical and basic science research with a National Institute of Health R01 grant, which is one of the hardest type of grants to get, has published numerous peer-reviewed journals, edited books, written chapters, presented nationally and internationally, but most importantly, he's here to teach students. So I feel very privileged to have him on our faculty, and with that, it's Dr. Barton.
All right, thanks everyone. When Dr. Murphy asked me to speak for an hour and a half, I wasn't sure. No, I'm just kidding. I just want to reiterate what a great day to be back together again. I've written this down. I'm going to read it pretty much. I'm much better at quizzing you guys about shoulder and elbow anatomy than I am about speaking about things like this. I want to congratulate you each on reaching a wonderful and special milestone on the pathway to becoming a physician. I especially want to thank Dr. Golly for bringing us together outside, Dr. Lewis and all the deans on the stage that are my friends and colleagues, our doctors that are up here supporting this school. I'm glad to be involved with them. I also want to congratulate the families and the loved ones of these students as well, as I know there's a lot of pride in supporting someone who's succeeding at something that is special. And a calling to serve others is certainly one of those things that I think is very special. I'm especially honored and humbled to be asked to speak to you today. There's a lot of ways to do this, but I'm going to tell a story. And I think this story will give some context for why we're here today. When I was a chief resident at Bentop Hospital at Baylor College of Medicine, which is in Houston, in orthopedic surgery, I was asked one evening to come down to the emergency room by one of my junior residents. He asked me to evaluate a patient that we knew was going to have to go to the operating room sometime pretty soon. This is a very common thing. I walked into the trauma bay. I met a young African-American man of about 26 years old who was involved in a motor vehicle accident. He weighed about 570 pounds. He had been an unrestrained driver and required about a 4-hour extrication. It took 4 hours for the fireman to get him out. Fireman said it was the smallest car he had ever seen driven, and it had this 570-pound man in it. The general surgery trauma team, which was excellent, was there. The patient was way too big to fit into the scanner. So they worked him up for injury right there in the trauma bay, as we do. He was only complaining of left leg pain. He was awake, completely with it, just complaining of his left leg. X-rays revealed he had severely crushed his left hip, the middle part of his femur or his thigh bone, and his tibia or his shin bone. I still remember the general surgery trauma attending, who was a very well-spoken, quiet, direct guy that pulled me aside. And he said, "Shane, you know, this young man very well may die because of his obesity. We're going to have to keep a close eye on him." And it wasn't often that this trauma attending would say things like this. But I remember him saying that and thinking, hey, it's no problem. We can fix his leg. He'll be okay. We took our patient straight up to the pre-op area to work on getting him ready for surgery with anesthesia. The entire time, this young man was smiling and laughing and joking with us, apologizing to us that he was causing us so much trouble. I went and met with his mom, which we always do, in the waiting room to let her know about our plan. And she said, "Take care of my boy," which every family says. We went in the operating room to work on this young man's leg. We spent an hour just getting him prepped and positioned. What I'd hoped would be a 2 or 3 hour surgery turned into a 6 or 7 hour surgery because of his size and the difficulty accessing the severe injuries. Also, by the end of the case, he had developed what we call a compartment syndrome. His leg had become so swollen there was no blood flow to the foot or lower leg, and we had to open up the skin to let the muscle swell out with a plan to come back later and fix this, just in an attempt to save his leg. He was admitted to the surgical ICU. He was extubated, and over the next day, he really began to bounce back. I was encouraged, would go out and give daily updates to his mom, who was in the waiting room every single time I went out there, without fail. During these visits, I came to find out this young man was the main singer in his church. I found this out because there was always a huge group of friends waiting to tell me how wonderful this man was. But you start to remember specific days, because on Wednesday, on Wednesday, his kidneys began to fail, and by Thursday, we were talking about dialysis. And when the patient, who was still very jovial and laughing, when he would laugh, he would cough, his lungs were filling up with fluid, despite the care of our surgical ICU team. Eventually, he had to be reintubated. That was on Thursday evening. I stayed in the hospital. I was on call that night. I thought he would die, like a lot of patients with this kind of trauma do. But he held on into Friday. And by Friday, he had stabilized again. We updated his mom. And that night, I fell asleep in our resident room on a big comfortable couch, as chief residents usually get to sleep through the night. But I stayed there, not really planning to, but just I didn't leave. At 2 o'clock in the morning, Taylor Brown, my junior resident, walked in to tell me that they had called the code. And of course, he had died. Because I'd given the update each day to the mom, and she always asked to speak to me to kind of make things simple like orthopedic surgeons make things, I had become the main contact, so I knew I had to go talk to her. This is 2 o'clock in the morning on a Saturday morning. No one had had the opportunity yet to speak with her, so she had no idea what was going on. I went to the ICU, looked at my patient. It's strange to see someone that you've taken care of lying there lifeless, but you will, and you'll have to deal with that. I remember putting my coat on to cover my wrinkled scrubs and walking in to talk to the family, thinking the mother would be there by herself, that I would have to console a distraught mom in an ICU at 2 o'clock in the morning. But I walked into a waiting room that had 40 or 50 family members and friends there. All supporting that mother and each other. Of course, the minute I walked through the door, most of them started crying because they had not heard from anyone and they knew why I was coming. But to my surprise, the mother was not crying. She came up to me. And said, "Dr. Barton, it's okay. I know you cared about my son." She hugged and comforted me. I had spent 4 years of medical school, 5 years of residency, learning to keep people alive when they were injured, and I felt like I had failed. I prided myself on being stoic in my work ethic, not caring emotionally to the point that it would prevent me from making decisions. I depended on my ability to take care of complex injuries, but this mother reminded me that because we cared about each other, it was not failure for her son to die. As you can tell, this patient and his family had a profound impact on me, how I view medicine and my part in it. And I'm sorry, my wife, she's heard this story many times. The only time orthopedic surgeons cry is when the x-ray looks so great, the bones are lined up so perfectly, okay? Look, in the rapidly changing world we live in, the evolving healthcare landscape and the technologies we utilize now, and we'll be able to use in the future, it's an amazing time for you guys to be physicians. But ultimately, you're going to stand at the bedside of a sick child, an injured mom or dad, a dying husband or wife or grandparent, and they expect and deserve our excellence in whatever field of medicine we're practicing. But most often, what they need and what that family and patient want is to know that someone genuinely cares for them. And you guys don't have to wait till you graduate to be that person to make that change. My advice for everyone here today is that as we travel along our individual paths, which will all be very different, that we regularly take time to reflect on our values that we hold close. And it's hard when you're busy. You got to take time. We need to humbly appreciate the blessings we've all been given. And remember to be thankful even in times of struggle, which absolutely will come. I would encourage you to be that person today that makes someone else's life better. lending a helping hand, or easing suffering, or just listening. Continue to strive for excellence with compassion in everything you do. You guys will have a joyful and fulfilling life taking care of others. I want you to live up to the life of service you envisioned for yourself when you wrote your medical school essay, which I've read too many of them this year. Congratulations on your wonderful accomplishment. And I hope you realize the gravity of what you've accomplished so far and what you have ahead of you. Thank you very much.
Dr. Barton, thank you so much for your testimony of what it is to be a physician. For all of you out here who will experience what Dr. Barton is talking about, and just for everybody on the stage, I personally thank y'all for your commitment in taking care of us. So thank you. Thank you very much. At this time, this ceremony is sponsored by the Gold Foundation, whose motto is Keeping Healthcare Human. We are gathered here to not only perform the white coat ceremony, marking passage to clinical medicine, as you have heard, but also awarding membership into the Gold Humanism Honor Society. It is an honor and privilege given to select third-year students chosen by their classmates. Dr. Morse?
Good morning. The Gold Humanism Honor Society, or GHHS, is the heart of the community of caring of the Gold Foundation. Founded in 2002 through the generous support of Robert Wood Johnson Foundation, the Berry Foundation, and an anonymous donor, GHHS now has more than 160 chapters in medical schools and residency programs. More than 35,000 medical students, physicians, and other leaders have been inducted and serve as role models of the human connection in healthcare, an example that Dr. Barton just showed us. It was a true honor for me to meet Arnold Gold, the namesake of the Gold Foundation, who sponsors both the white coat ceremony and the ceremony of the Gold Humanism Honor Society. Dr. Gold was a respected pediatric neurologist who championed compassionate care for patients and started this foundation based on that principle of care for patients. The GHHS sponsors Solidarity Week for Compassionate Patient Care and Thank a Resident Day, both recently celebrated in February of this year. Both projects champion the return of humanistic care for patients and our fellow colleagues. Membership in GHHS goes beyond selection and induction into an honor society. Its members have a responsibility to model, support, and advocate for compassionate, patient-centered care throughout their careers. The creation of a GHH chapter signifies to the medical community that an institution places high value on the interpersonal skills and attitudes that are essential for the highest level of patient care. The Gold Foundation logo, featuring a golden Mobius loop, symbolizes the continuous bond of trust, respect, and communication that connects healthcare professionals with their patients when humanism is at the core of healthcare. Usually we have several more faculty members and other physicians here, but I just want to give the opportunity, if there are any physicians here who are members of the Gold Humanism Honor Society, will they please stand? I now call forth Dr. Beal to assist in reading the names of the inductees for the Gold Humanism Honor Society. So for students, you'll come around the back side of the tent to the left side of the stage for your certificate and pinning.
These are not the right earrings for a mask. Okay. Okay. Catherine Babin. I'll give you a minute. Catch up. Okay, you're going to go right there. Baylor Barron. Ezra Bess. Rebecca Daggett. Allison DeReese. Joseph Drinkard III. Hannah Hansen. Jessica Hicks. So while Dr. Morris is doing that one, I'll just tell you, hold on to these pins. You're getting one now and then one if you're in GHHS, and I lost my first one, and it makes me sad. Taylor Hill. Garrett Hauk. Grace Hunt. Leah Kaplan. Carver Montgomery. Ian Nairn. Mindy No. Lynn Wynn. Okay. Stephen Patten. Yes. Hey, I love it when I get names right. Harley Passo. Brenna Sanders. Rachel Trier. Jeremy Watson. Okay, now for our resident inductees, Dr. Junaid Ansari. And then I'll read a few of our residents. They're not here, one for her own wedding, so I guess I'll excuse it. Dr. Tanya Gooden, Dr. Lauren Lowry, and Dr. Patrice Rankin. And then we do have Dr. Yoko Young Sang. And then for our faculty, we're missing Dr. Kenneth Abrio and Dr. Roger Kelly. But we do have Dr. Sri Kulkarni. And then if our GHHS inductees would please stand for your oath and repeat after me. I pledge by all that I hold dear as a physician, I will care for my patients with compassion, respect, empathy. Can you remember all that? I will care for my patients with compassion, respect, empathy, integrity, and clinical excellence. Sure, mini mental status exam. Okay. I will listen to my patients with my whole being. I will advocate for each patient as a unique individual. I will serve as a role model and mentor to promote humanism in healthcare. I will remember always the healing power of acts of caring. I will dedicate myself to joining with others to make healthcare optimal for all. Okay, congratulations.
Congratulations. At this time, the Gold Humanism inductees and their guests, you may be dismissed or you're welcome to stay for the white coat ceremony. Okay. We have several medical students who will serve as assistant marshals, helping to direct the sophomore medical students as they come forward to be cloaked and receive their Humanism in Medicine pin. Would the assistant marshals please take their places? So sophomores, I will do my hand like this. We're going to go by one row. You're going to go this direction and then enter the stage this way. If you'll please have your white coat over your arm. Yes, if you'll take them off now. And place them over your arm. Yes, thank you. So would the first row rise? You may wear your mask, but if you'll please take it off when you get up here because they'll be taking pictures. Okay, so first row. So at this time, if the assistant marshals will please bring forward the first students to be cloaked and receive their Humanism in Medicine pin. Just stop right there. I take great pleasure in introducing to you at this time the marshals for this white coat ceremony. Would the marshals please come forward? Dr. Lewis, Dr. Warner, Dr. Morris, and Dr. Bill. At this time, I would like to ask Dr. Debbie Chandler to come forward.
Good morning, and thank you for being here with us today. I will now call the names of the sophomore medical students in alphabetical order to be presented on stage. Students, you will be called in pairs. Tunde Abubakar. Christine Marianne Almazen. Sam Nuwang Amarazenke. Alexandra Ildiko Henderson. Victoria Christine Andrews. Alexis Lee Angelette. William Patrick Armstrong. Catherine Ann Murphy Baldwin. Rachel Grace Barlow. Ashley Angeli Barra. Kyle Timothy Barron. Sarah Catherine Bertrand. Pranav Bhargav. Elena Joel Boardman. Bryce Joseph Bonin. Jacob George Bonville. Cade William Bourgeois. Kerrigan Alice Bowman. Sean Christopher Brignac Jr. Avery Caroline Bryan. Haley Suzanne Canizaro. Joshua Ray Kasky. Tyler Michael Chauncey. Nicholas Joseph Cormadell. Zachary Michael Connelly. Devin Michael Cormier. John Connor Cox. Carol Nicole Crochet. Julia Rose Cucarola. Caroline Jane DeGros. Ariel Elizabeth Deguerre. Blake Miel Delacroix. Alyssa Gabrielle Derwin. Alison Danielle Deforge. Natalie Michelle Domingue. Kaya Cosette Dowell. Edwin Anthony Dudusat IV. Rebecca Elise Duhon. Chichindu Chimela Iki. Benjamin Rex Ellison. Sydney Corinne Escott. Evan Paul Falgu. Philip Garrett Fincher. Andy Lee Fontenot. Joseph Weldon Fur Jr. Jordan Ray Gehagen. Haley Elizabeth Gold. Evan Michael Grison. Colby Regan Hansen. Joshua Dillon Harper. Hunter Deakin Hines. Teresa Horan. Jeffrey Tyler Howard. Fatma Iqbal. Taylor Reed Johnson. Elizabeth Wayne G. Jack Stephen Jenkins. Catherine Ann Johnson. Tori Lane Johnson. Ahmad Jad Kasabali. Robert Joseph Klaczynski. Colby Brent Kuntz. John Martin Laforge. Jordan Keith Lange. Kaylee Lee Leach. Alice Eugene Lee. Kenna Nicole Lethy. Rory Edward Legendre. Stephen Paul Lemoyne Jr. Nikki Mariah Lentini. Oh, the trio. Kendall Barrett Lewis. Kyle Brent Lewis. The twins. Stuart Joseph Lockett. Catherine Ashley Law. Hannah Brooke Logan. Kevin Thomas Melon. Patton David Mangum. Timothy Scott McBride. Grace Ann McCurdy. Michael Thomas McDonald. Jacob Talmadge McDowell. Margaret Camille McNew. Michael Addison Meader. Chandler Elizabeth Merriman. Alice Renee Moti. Peyton William Moore. Warner Justine Moore. Anna Grace Morris. Rama Muafal. Asad Musarat. Hassan Kasim Nawaz. Meredith Eloise Nelson. Meskerem Amenu Nemomsa. Christian Wen. Johnny Wen. Tenley Wen. Marco Nikolic. Mariah Angel Norder. Nicholas Patrick O'Connor. David Okwampa. Congratulations. Caitlin Danielle Parker. Rachel Catherine Parks. Brandon Plant. Rebra Joseph Price III. Danielle Anthony Provenzano. Lauren Lindsay Rando. Amy Lynn Wren. Arthur Rizayev. Brady Christopher Rice, Shelby Miller Ryder, Ross Garrett Rieger, Alida Claire Robin, Maggie Martin Ross, Miriam Elise Tu Ruoff, Catherine Mary Russo, Robert Walter Roots, McKelly Catherine Sillard, Hillary Ann Savage, Vishwa Parag Shah, Alice Ann Swallow, Maddie Elizabeth Steve, Alexa Mary Tafaro, Samuel Huey Taylor, Morgan Spalida Teal, Alfred Joseph Thomas IV, Bennett Harding Thomas, Carlton Ray Toops. Lyndon Lawrence Tujac. Bailey Tuberville. Victoria Grace Umling. Robert August Van Langendonk II. Alexis Joel Vega. Reena Divya Wadwa. Sunil Kumar Wadwa. Sarah Elizabeth Wagner. Robert Anthony Walton. Jordan Joseph White. Imasha Rijitang. Taylor Calhoun Wilmore. Cade William Weibel. And our last one, Alexandra Freddie Ann Zerang. Let us give a round of applause for these student doctors.
Okay, everybody has their coat back on, so you were shivering over here, so you've got your coat back on. Thank you, Dr. Chandler. The LSU Health medical alumni play a vital part in the important rite of passage for our medical students. From donating money to purchase the white coats that you're wearing, to actually robing and pinning the students in the white coat note. Our medical alumni from across the country, whether they have been practicing for decades or are still in their residency, have submitted their words of advice to you, encouragement or inspiration to our students as they transition to a more patient-focused portion of their education. The idea behind the notes is to create a meaningful connection between alumni and the current students, and to show the students that they can depend on their support and guidance in the profession from their fellow LSU Health physicians. The school solicited advice from graduates, and the response was remarkable. Some are handwritten, while others are submitted digitally. Some alumni opted to include contact information and serve as a mentor for the students. The notes have been randomly placed in the pocket of the white coats. We will now take a few moments to allow the students to read their messages. Yes, go ahead and do that. And this is just another sign of their support of you in your journey. They remember that journey well, and of course they wish you well in the next 2 years in your future residencies. At this time, Dr. Lewis will come forward to administer the oath for the class of 2023. Dr. Lewis? For the class of 2023, would you please stand for the recital of the oath?
Okay, so we're going to try to do this together. I'm going to have y'all say something after me, and everybody needs to say something. Dr. Warner's back here taking notes, and she's going to take points off your step 1 score if you don't talk, okay? So, oh, I'm sorry, I'm not supposed to talk about step 1, am I? Not yet. All right, so seriously, you know, in medicine, we take several oaths, and do you guys have this? No? It's on the back of your program. Do you have a program?
Yes, they should have gotten the program. Okay, then you'll have to lead them through it.
Well, here we go. I guess you guys. So remember what I just said? Forget that. Okay. Yeah, I don't know how we're going to do this, but because some of this is a little longer. Let me read the oath, and I guess you guys, I don't know how this is going to work. We'll get through it. Yeah, so if you have it, please say it with me. As I now enter into the area of my medical education, where I progressively increase my interaction with patients, I acknowledge and accept the privilege and responsibilities given to me as a physician in training. As a member of the healthcare team, I will present at my assigned duties and will not fail to do my share in the care of our patients. I will approach my medical education with integrity and will support my classmates. I will respectfully acknowledge my teachers, be they faculty or other healthcare professionals. Likewise, I will respectfully acknowledge my patients at whose bedside I will learn. I commit myself to a lifetime of learning both in the art and science of medicine to better serve my patients. I will attend to all my patients with competence, without bias toward any, and with compassion toward all. I will safeguard their trust, will respect their secrets, which are confided in me, and will serve as their advocate. I will communicate with honesty and kindness and understanding. Responsibly within bounds of my training. I will work to learn to cure disease where possible and to prevent disease where opportunity permits. I will promote and protect the health of the public as well that of my patients. I will not forget the importance of my own being and the well-being of those close to me. These pledges I make freely and upon my honor. Congratulations to each of you.
Thank you, Dr. Lewis, and thank you, students. If you'll please be seated. At this time, well, I would ask Dr. Kay to please come up and give a few thank you words.
Thank you, Dr. Murphy. Dr. Ghali said I should make it short since we're all freezing up here. I just wanted to once again thank everyone for your hard work completing the first 2 years of the basic sciences in the backdrop of the COVID-19 epidemic. For most people, the clinical years are more enjoyable as you integrate your knowledge about medicine into the greater good of helping patients get better from their different diseases. And this ceremony, this white coat ceremony, notes the special day as you move forward to the clinical years. Remember, this is an honor, and always be grateful for what you have in your life. Loved ones, your health, your mental faculties, your favorite pet. Nothing is guaranteed. So be careful for what you have. Be grateful for what you have in your lives. For those patients you'll take care of, they are in jeopardy of losing their health and even their lives, along with loved ones, their job, and ability to make money and the things that make them happy, like activities and hobbies that they may never be able to do again. As an example, just the other day I saw a patient in my pain clinic who started hiccuping 6 years ago and has done so continuously 24 hours a day, even after brain surgery to remedy his problem. He can no longer work and is afraid to eat because it makes his hiccups even worse. The people you take care of have real problems, so please treat them like they were your family, and you will earn their respect and admiration throughout your professional careers as physicians. Humility and gratefulness will be incredible qualities to remember for the rest of your lives as physicians. The world needs doctors, and remember, only a select few are chosen for this noble profession. Enjoy this day, and thank you to everyone who has worked hard to guide these young medical students on their path to becoming physicians. Thank you.
Thank you, Dr. Kay. Congratulations to each of you, members of the class of 2023. I would just like to thank the Medical Communications Department, IT and AV support, and Alumni Affairs. Thank you for helping this as a collective event. And also for Student Affairs, Dr. Chandler, Laura Grayson, and Kimberly Voorhees. Thank you for all your work. I also want to say thank you to the Faculty Wives Club. We were here yesterday preparing a celebratory dessert for you, and they are serving you this morning. So thank you to Mrs. Anita White, Mrs. Sally Morris, and Mrs. Brenda Traylor. To the assistant marshals and to the marshals on stage, thank you. Family members, faculty, and friends, thank you for being here at this milestone event. Please be sure to pick up your individually boxed cupcake and beverage. Thank you for being here today. Enjoy your time with your medical student and travel home safely. And stay warm.